Blood flow restriction training is a boost to your strength or cardio training, a tool for recovery, and especially great for rehabbing from an injury or surgery. Back in 2019, before the big surge in popularity and the fancy devices popped up, I was utilizing blood flow restriction training and was fascinated by the concept of basically high altitude training for your musculoskeletal system. Back then, we used a Doppler ultrasound and a manual blood pressure cuff that we pumped up and used the Doppler ultrasound to calculate the limb occlusion pressure. This manual process was a lot of work compared to the advanced devices used today, but we had great results with amputees and neuro patients. Fast forward to today, blood flow restriction training is popular in orthopedics and amongst many professional athletes for rehab, recovery, and enhancing performance. It has been thoroughly researched to be safe and effective. There are now numerous certification programs available for physical therapists. I became certified and have now taught many physical therapists and physical therapy students on how to use this tool effectively. I've also enjoyed a lot of the benefits myself. I'm not all for trendy physical therapy devices that only provide like 1% benefit because so many of these devices are a waste of time. But blood flow restriction training is something different. It's been rigorously studied and has substantial evidence for the benefits of muscle growth, tendon strength, joint health, bone density, and cardiovascular health. The way it works is we use the AI-driven SmartCuffs 4.0 to calculate your total limb occlusion pressure, and then we apply the appropriate pressure for full venous blood flow occlusion and a specific percentage of occlusion of arterial blood flow for your upper or your lower body, with the pressure dependent on location, goal, and the exercises that we are planning on using them. Now that you got the cuffs on, we apply exercises while partially occluding your blood flow. This has a number of effects. It challenges the cardiovascular system. It traps blood flow, which traps metabolites from the exercise. And it limits your oxygen supply to the extremity. This combination of effects together triggers signaling pathways in the body that are normally triggered with really intense high-load training, despite your body being under minimal load compared to equivalent level exercise. This way, you can get the effect of intense exercise with less muscle breakdown, less stress in the joints, and soft tissue. Normally, these tissues can take the stress, then recover, and then get the adaptations like normal progressive loading, but it takes time for your body to recover from exercise like this. With blood flow restriction training, the signal for adaptation is triggered to provide the benefits without the breakdown that typically requires a lot of recovery due to the stresses it places on your body. This means you don't have to add to your overall training volume and injury risk while maximizing the benefits. Blood flow restriction training can be very enjoyable for people who love fitness and the benefits of exercise, but it is not a replacement for regular exercise. It is a tool to complement strength and/or cardio training, as well as enhance recovery, and it's great for rehabbing an injury or from surgery. And blood flow restriction training has very few side effects, like sometimes some mild bruising around the cuff areas, some temporary discoloration of the limb due to blood flow impact while you're exercising, although it's been shown that that's where the effect comes from, so you're actually looking for that discoloration. Some people can feel some numbness or tingling while they're using the device. And also, it can be pretty intense of a feeling of exercise despite the load being pretty light. You'd be surprised. All these side effects should dissipate pretty quickly after use. There are some individuals predisposed that will need to go through some safety screening to assess for any risk of adverse effects, but if you're not predisposed, any risk of serious adverse effects are pretty minimal. In fact, when passing the safety screening, many cardiovascularly compromised individuals can use this as a tool to enhance their cardiovascular health. If you're interested in using blood flow restriction training or have any questions about it, I'm a total nerd about this stuff. So just contact me and I'm happy to chat with you.